You can get some?
No, I can't.
Oh, but some, after some.
You think so?
But you're saying you must
You need my other special mask. That's the best project.
Simple. I'd like him to wear the mask towards the presentation. Will that affect the sound?
It will affect the sound.
Okay.
Maybe for him, but
Affect the sound.
For you guys. Edward, frame me nicely. Thank you. Thank you. Okay.
okay. So
I can hear some.
she wants to be getting some.
So he.
Since we've notified it. What's that called?
Yeah, she wants to be getting some. But she can hear Mr. Chair. Yeah. No, nothing.
Hi, Bertha. I can hear you, but I can't hear studio.
Yeah.
Good morning, sir. Thank you so much for joining us at the Decade House. This is our 30th COVID-19 update led by the Minister of Health. And like you said earlier on, we are just settling down and the Minister will be ready to give his address just now. And a lot of people have continued to adhere to some of the guidelines that have been put in place. This morning, we did visit some supermarkets that are not allowing people to enter their supermarkets without the masks, meaning that the Mask Up campaign has been intensified. There are also buses who have stopped allowing passengers to get on the buses without the masks. So, Sam, I know yesterday you were on hand talking about the Mask Up campaign, and now it is a reality. People are adhering to not going into public without the mask, but more can be done. Thank you so much, sir. So right now I will be handing it over to the Minister of Health, Dr. Chitala, to give the address on the COVID-19 update. This is the 30th update when it comes to the daily updates that we have been following as the media and the nation.
Good morning, countrymen and women. Good morning, members of the press. And welcome to today's update. Under the guidance of His Excellency, the Republican President, Dr. Edgar Chagwa Lungu, the multi-sectoral team set up to fight COVID-19 continues to apply its vigor to minimize the danger and impact of COVID-19 in our nation. His Excellency President Lungu is monitoring the evolution of this epidemic and is leading the charge in implementing a scalable plan that will strictly be commensurate to the state of the epidemic. COVID-19 is an invisible enemy that can only be defeated with visible participation from all of us. There is therefore need for all citizens, everyone in every community across Zambia, to develop a sense of personal responsibility and a sense of agency in this regard. I wish to emphasize that the measures that we are taking today, as announced by His Excellency President Edgar Chagwa, will only be effective if all of us play our role. Every individual, every household, every community has a role to play in this response. The fate of COVID-19 in Zambia is in our hands. Let us hold together and let us not take for granted anything. What we may see as small mundane actions may impact the trajectory of the pandemic either positively or negatively. Allow me now to, on behalf of government, update you on the status of COVID-19 outbreak within and outside Zambia. Members of the press, countrymen and women, we have lost the 19-year-old patient who had attempted suicide by consuming a herbicide called Paraquat. The herbicide predominantly causes respiratory distress in addition to multiple organ failure. She was in a critical state and our specialized team did all they could to manage her condition. Unfortunately, she was also notified for COVID-19. We lost her. We pay condolences to the family on behalf of government. We observe a minute of silence in honor of the deceased. May her soul rest in peace. Today marks exactly 1 month since the first lab-tested cases of COVID-19 were reported in our nation. In the last 24 hours, Zambia conducted 397 tests, and out of those, 4 were recorded positive. So Zambia has recorded 4 new positives of COVID-19, and that brings the total number of cases to 61. With the death that we recorded that is COVID-related, the mortality has now risen to 3. So cumulatively, we have 61 cases of COVID-19 recorded, 3 deaths, 33 recoveries, and as we speak, we have 26 under our care. It should be corrected. Let's proceed. When we analyze the 4 that we recorded as positive in the last 24 hours, we have again picked 2 from Kafue, 1 from Kafue Estates and 1 from Kafue Railways. The other 2 are our own medical staff at Chilenje Clinic, Chilenje Hospital, who are managing this patient who died. This is 1 nurse and 1 medical licentiate. We have embarked on a robust mass contact tracing program, and we are testing all the contacts, and all those found positive are being isolated in our facilities. The rest of the 397 tests came out negative. That shows the graph by date of reporting, and that just shows you where we started from, and there is a trend line that shows you the figures as they were recorded. We have mapped the country and seen where our cases are coming from. So the cases are coming from Kafue, Lusaka district, and we've recorded a case in Kabwe. If we analyze further by looking at the contacts that we are following up in our various places, and you look at the map that is following in the next slide. Next slide, please. Right, the slide that we should have shown is showing you where the contacts are. We've seen contacts being found in various parts of Lusaka, meaning that it is possible for us to have various parts of Lusaka with cases of COVID-19. So the positive cases, we're creating trees and following up the map in various parts of Lusaka. And these cases are being tested, and they are the ones that are either coming out positive or negative. I want to emphasize, countrymen and women, that the COVID-19 outbreak could easily be stopped if we followed the measures that the President has announced in his address to the nation. Let us ensure that there is social distancing. Let us stay home and stay safe. Let us avoid mass gatherings, and let us stop shaking hands. Let us wash our hands. Let us ensure the environment is clean. Let us wear masks everywhere we are. Let us put on masks. Let us avoid non-essential travel, be it local or international. Let us be home. This is the only sure way of us stopping this epidemic. It is in our hands to do this. Moral discipline, personal responsibility is what we need to focus on. We've recorded 3 deaths. We can record more with poor compliance. We have 397 cases with only 4 new cases. 397 tests with only 4 new cases. We'll be increasing the number of tests. And if we disrupt human-to-human transmission by staying home, we'll be recording less and less positives. If we look at where we are today, we have done a total of 2,586 tests, and we have also investigated 8,709 high-risk individuals. Out of those, 2,482 have been discharged off the 14-day quarantine period. And we want to thank the community for being alert and having brought to our attention 760 cases of alerts. When we analyze what we were doing in Kafue yesterday, we collected 46 swabs, and out of those 2 were positive. The mission for contact tracing, mass screening, and targeted testing will continue in Kafue. We also moved into Chilenje, and in Chilenje, where that case, where we lost the woman with organophosphate poisoning, we tested 30 of the contacts within the hospital and outside the hospital, and that's why we recorded 2 positives, 1 nurse and 1 medical licentiate, and 28 were found to be negative. Let's look at what's happening globally. We still see that the cases are in all the continents, and we still see cases rising in various parts of the continents. Next slide. Next slide. Right, just previous slide. So globally, we have recorded a total number of 2,332 cases and 4, and we have lost 160,767 cases. And this is now affecting 210 countries and at least 2 international conventions. Back in Africa, we see that the numbers in Africa again are increasing, And we see that we have recorded in Africa 21,741 cases with 1,082 deaths. We have recovered 5,470 cases. The top 10 countries you can see up there, and the numbers are increasing up in South Africa and in North Africa. In SADC, the region we belong to, we see South Africa with the highest number of cases and 52 deaths. Zambia next there with 57 cases with 2 deaths. And we see all the other countries in the region, they are recording cases. And that's how we have recorded a total of 3,245 cases with 63 deaths and 965 recoveries. Distinguished ladies and gentlemen, a reminder of the causes of the signs and symptoms. If you present with a fever, a cough, difficulty in breathing or shortness of breath, chest pain, headache, then you are supposed to be screened. You're supposed to be tested for COVID-19. How do you protect yourself? Regularly wash your hands, avoid close contact, that's social distancing we're speaking about. Stay home and be safe. Stay home and be safe. Stay in your district, stay in your town, stay in your home. Avoid even visiting your neighbor. Make sure that you cover your nose if you have a cough or a flu as you cough or sneeze, and ensure that you always put on a mask. We have numbers that are on the screen that you call whenever you have any symptoms. Call those numbers. We do not encourage you to visit just any hospital because it may not be a designated hospital for us to manage COVID. We encourage you to call any of those numbers, either 909 or any of those numbers that are showing on the screen for help. And our rapid response teams will quickly move in and ensure that you're transported to the appropriate COVID-19 facility for further management. We will reiterate the call from His Excellency President Lungu that we avoid mass gatherings, that we stay home, avoid weddings, church services, that we ensure that we are not in any crowded or congregate settings such as academic institutions, such as schools, that entertainment facilities remain closed, and let us be compliant. And furthermore, let us enhance hygiene at personal and collective level. And critically, let us ensure that we comply or cooperate with health workers as we do screening and targeted testing. And for those who come into the country, you will be subjected to a mandatory 14-day quarantine in a government-designated hotel or facility. Ladies and gentlemen, as I conclude, let me focus on the strategy going forward. The strategy that the government of His Excellency President Lungu has embarked on in the fight against COVID involves early detection of cases, isolating them, and ensuring that there is no human-to-human transmission in the community. This, therefore, places premium on, we therefore place premium on testing, increasing the numbers that we are testing in the communities. Our approach is therefore going to focus on increased screening and testing in our various communities. So you are going to see our teams in Kafue, in Lusaka, in Kabwe, in selected parts, screening citizens and doing targeted testing. The number of tests that you're going to be seeing will be increasing by the day. This is to ensure that we pick out all the positives, isolate them, and not allow them to transmit to the next person. We urge you to to cooperate fully with the teams as they come into your various jurisdictions. We'll continue contact tracing, we'll continue quarantining people, and we'll continue case management in our various institutions. The patients that remain under our care are all stable, and we want to thank the members of staff in the Ministry of Health and other institutions and other sectors who are working very hard across the continent of care in the fight against COVID. Therefore, the call to action: frequent hand washing, wear a mask, keep your environment clean, no public gatherings, physical distancing, stay at home and be safe. Lusaka, by the Public Health Act, is an infected area. Lusaka is not an area where you should be visiting routinely, where you should be visiting unnecessarily. The unfortunate case we had recently of people having a funeral in Kafue and traveling all the way from other parts of the country to come and attend the funeral is what will spread the COVID countrywide. Therefore, learn to stay home. Express your solidarity by phone and send your support, but do not travel for unnecessary gatherings, because you will get COVID-19 as you visit funerals, as you visit various activities, various places in Lusaka province. Our provincial health teams, working with the provincial administrations and various stakeholders, have continued to increase surveillance in their jurisdictions, have been mounting spot checks where they're disinfecting vehicles, they're disinfecting people, and also ensuring that those who are at risk are not allowed entry. We are urging all the provincial administrations and provincial health officers and task teams to strengthen surveillance at the ports of entry, to ensure that we continue mass screening for all people who are coming to the country through truck drivers. We want to ensure also that the screening, the testing is decentralized. As we speak today, we are testing in Lusaka at the virology laboratory, in Indola at the TDRC. We will be extending to all provinces in our biosafety level 2 laboratories as we get the cartridges for gene expert machines that we have countrywide. Therefore, in the next few weeks, we will be able to roll out testing in all the provinces. For now, there's a robust sample referral mechanism, so we get all the tests from the rest of the country, tested in Indola or Lusaka. Countrymen and women, all of you, avail yourself if you're in Kafue for testing. Avail yourself if you're in Lusaka at any opportunity that we announce that we will start mass screening, and will position laboratories, be it mobile, or will position staff to come to your various jurisdictions. Cooperate. The strategy, I reiterate, is mass testing. Let's get all who are positive isolated so that we do not entrench person-to-person spread. If we all cooperate with the government and follow all the measures that have been articulated in the President's address, then we will fight and end COVID-19. So, 61 cases of COVID in Zambia, 3 deaths. We have 26 under our care, and we have 33 recoveries. Thank you for watching.
Thank you so much for the update from the Minister. We now invite questions from the media. So you come to and do this microphone here. You can come to and use this microphone here.
The next question.
Next question.
Good afternoon. My name is Sonia. I wanted to find out if the ministry is considering doing testing in vulnerable groups such as street kids, and things like that.
Good morning, my name is Ruth Chang from NBC. Firstly, there's some concern from the public that yes, in as much as government has put measures in place, there's no firmness in the execution of these SIs. Then secondly is an update on the recruitment of health personnel following the spike in cases. And thirdly is how are pregnant essential workers being protected during this period. Thank you.
My name is Tricia from ZNBC, and I just want to find out an update from the minister on the boy that tested positive in COVID and the family that visited them from Zambia. How far are we in as far as getting those results?
Well, thank you very much for those questions. When we have a mortality in a hospital, we should remember that if that case was notified as a COVID-19 case, we manage them in isolation units. The patient in question came in as a very severely ill patient with poisoning using a herbicide. The herbicide itself is able to collapse the lungs. It's able to cause multiple organ failure. The patient need not have had COVID to die. The poison itself was adequate to kill the patient. And all the investigations did show the impact of the paraquat, the herbicide, on this patient. So, since COVID is a notifiable disease, and this patient did test positive to COVID, the ward where we were managing this patient has been disinfected. All the contacts within the hospital and outside followed up. It is important to note that we sterilize, we're able to test and quarantine those who are positive in our isolation facilities. Adherence to SI 21 and 22, or indeed provisions in the Public Health Act, or what His Excellency the President has pronounced to the public, should not be dependent on the whip. It should be our responsibility. It should be the imperative we must inescapably adhere to. We must take personal responsibility to adhere to those. So I can only appeal to all citizens to adhere to the provisions of the statutory instrument 21 and 22 of the Public Health Act and to the guidance of His Excellency President Lungu as we combat COVID-19. The fate, the outcome will be determined by our commitment to the measures that have been pronounced. Recruitment of health workers is progressing, and health workers will be deployed to ports of entry, and also will be the ones you see in the field coming to do mass screening and testing. As you know, the core strategy in the fight against COVID is finding the cases early, isolating them, treating them there, and ensuring that there is no human-to-human transmission in the community. was also a question on pregnant essential workers. First of all, let's ensure that we all wear personal protective equipment such as masks. And the essential worker who is pregnant will be protected through, one, putting on personal protective equipment, and also ensuring that the workplace is not placing the pregnant health essential worker at risk.
Colleagues from the media, do you have more clarification? Right, Minister, there have been no further questions or clarification from the media. I will now invite you to give a summary of this.
I would like to take this opportunity to, on behalf of government, thank cooperating partners, corporations and private citizens alike who continue to partner with governments to fight COVID-19. The Jack Ma and Alibaba Foundations have generously donated additional sample collection swabs. This will help us increase testing everywhere where we're supposed to be testing. We want to thank the government of Ethiopia. His Excellency the Prime Minister of Ethiopia did facilitate through Ethiopian Airlines the delivery of these supplies to Lusaka. All corporate institutions that have worked tirelessly, holding hands with government to support this response, we thank you most sincerely. We want to thank the multidisciplinary, multi-sectoral workforce that is at the front line for the work they are putting in. We urge you on, and Zambia is proud of you. His Excellency President Edgar Chagwa will continue monitoring the epidemic and will continue adjusting the scalable plan in alignment to what data is being adduced, in alignment to the phase of the epidemic. I want to assure you that we will do all there is to ensure that COVID-19 is stopped, but the big stakeholder is you and me, adhering to what is decreed in the President's address. Wash your hands, mask up, keep your environment clean, maintain social distancing, stay home and stay safe. Stay away from Lusaka, stay home and stay safe. Thank you very much.